Hi, I am Myla Joyce Cantoja, a first-year nursing student at Central Mindanao University. Today, I am going to demonstrate the procedures for donning of personal protective equipment or PPE. Before we start with the procedure, we need to do an assessment, which is to check the current record of the patient and know whether the procedure requires the use of gloves and ask the patient if he or she have latex allergies. The possible nursing diagnoses are the risk of contamination related to inappropriate use of protective clothing and risk for allergic reaction. Procedure number 1. Ensure a trained observer is present to verify compliance with all the steps. Check all PPE is serviceable. Check each step that PPE has been done on correctly. Procedure number 2. Conduct briefing. Ensure all supplies are ready to be taken in. Review what will be achieved in the high-risk area. Preparation prior to donning of PPE. Wear scrub suit. Wear plastic or rubber boots. Remove jewelry, cell phones, pagers, pen, ID, and badges. Go to comfort room to ensure hair and eye glasses. Inspect PPE prior to putting on. Everything is available in good condition and sizes are correct and appropriate. Trained observer and healthcare worker review the steps before beginning. Trained observer reads the following steps 5 to 12 to the healthcare worker in a step-by-step fashion.
Procedure number 5. Put on both cover. To provide protection to the toes and the foot, it is made rubberized to protect from heavy objects that may fall. Procedure number 6. Hand hygiene with alcohol-based hand rub, EVHR, or soap and water. Hand hygiene prevents the spread of microorganisms and kills whatever bacteria you have in hand. Procedure number 7. Put in inner gloves. Gloves protect hands and wrists from microorganisms, and gloves act as a barrier to reduce the risk of exposure to blood. It prevents potential skin exposure. Procedure number 8. Put on coverall. Coverall must be large enough for free movement. Top of inner gloves under sleeves of the coverall. Zip up all coverall. To ensure that the medical worker is protected against a number of hazards that can be encountered. If not large enough, it will prevent movements. Procedure number 9. Make thumb holes at the borders of the cuff and sleeves. Use a scissor to make a small incision. Insert thumb through the hole. The thumb opening prevents undesirable distal or proximal movement of the extendable sleeve cuff during movement of the arms, finger, and thumb, thus providing uninterrupted coverage of the hand, uninterrupted warmth during such activities. Procedure number 10. Put on N95 respirator. Cup the respirator in your hand with nose piece at your fingertips, allowing the ties to hang freely below your hand. Position your respirator under your chin with the nose piece up. Hold the top strap over your head, resting it high at the back of your head. Pull the bottom strap over your head and position it around the neck before the ears. Mold the nose piece using two fingers of each hand to the shape of your nose. To ensure correct positioning, to properly cover the seat areas. To ensure the best fit and the mask must cover both the nose and the mouth because air moves in and out of both. Donning and correct mask properly reduces the risk of exposure to airborne microorganisms and from flushing fluids. Procedure number 11. Perform self-check. Exhale sharply. Inhale deeply. To ensure that there is a good seal around the airways and the respirator so that there is no raw or non-filtered air to pass in either direction. Note that this check should be carried out whenever a respirator is worn and it not substitute for prior fit testing. Procedure number 12. Put on the hood of the coverall. Cover the N95 respirator. Cover all of hair, ears, and neck. To ensure that all areas are covered and no hair is protruding from the hood since it is the final line of defense of the PPE to protect a healthcare worker from an infection. Procedure number 13. Put on outer apron, tie with simple bow. To minimize the risk of contamination being transferred between your clothing. Procedure number 14. Put on outer gloves with outer extended cuffs. Ensure the cuffs are folded over the sleeves of the gown or coverall. Gloves act as a barrier to reduce the risk of exposure to microorganisms. Procedure number 15. Put on face shields and goggles. Use anti-fog spray to prevent fogging. Over the N95 respirator. Cover all of ears, and neck. Properly reduces the risk of exposure to microorganisms that may occur from splashing fluids. Procedure number 16. Lift the trend observer check the word PPE. All skin must be covered. Comfortable, able to extend the arms, bend at the wrist, and the range of motions. All areas of the body remain covered during range of motion. To assess whether the PPE is properly used and to check if the entire body is protected and covered, to ensure that the healthcare provider should be comfortable and able to extend the arms, bend at the waist, and go through a range of motion to ensure there is sufficient range of movement while all areas of the body remain covered.
You are now ready to enter the high-risk area. Never touch or adjust PPE. Alert safety officer that you are entering high-risk area.